Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Today's topic of choice is nothing but growth and development. Case presentation part 3. I hope my $1,000,000 voice is coming to everyone. Good evening, beautiful people. Let's start this class. My name is Dr. Anand. I have done my MBBS from Rajiv Gandhi University Health Sciences. Then I did my MD in the field of pediatrics. I hope my voice is coming to everyone. Then also for the newcomers who are not, who don't know me, I did my MD in the field of pediatrics. Then I did my SRship from Lady Harding as well as from NDMC Medical College. And we have some average teaching experience to all the UG and PG students and students applying for DM and MRCP CH exam. Today's topic of choice is growth and development, and the subtopic is nothing but very importantly case presentation part 3. Amazing questions are gonna come. Let's start this class. In this beautiful segment, we always have a motivating quote before starting any class, and today's beautiful $1,000,000 quote is, you did not come this far, you did not come this far to go only this far. You did not come this far to go only this far in life. Please remember, like you have a long way to go. There are people, sometimes during the path of success and path of life, we get really tired. I know you have so much to study, I know you have so much to remember, but remember, you are the only architect of your life, so you better make something nice from your life. Okay, life is really beautiful. Just remember, you did not come this far to go only this far. Good evening, everyone. Hello, Dr. Grace Pandey, Manish Yadav, Karan Orion, and Shubham, Osama, Shubhangi, Bhavna Mankar, Dr. K, Sharma Neha, and all the amazing, beautiful people. Let's start this class. Yes, so now the case presentations are coming to an end. This is the part 3. Like if you watch my case presentation videos, you'll get a ample amount of idea. In this beautiful case presentation, we understood we need to take the patient's name, age, sex, occupation, address, and informant being the mother. We were on the sex, and okay, let's cover back-to-back questions. Can you please tell me in the comment section, color blindness? Can you please tell me? Yes, exactly. Yeah, color blindness. Color blindness is common in males or females. What do you think, Karan? ओके करण विक्रम सिंह यस शुभम क्या हाल है मेरे भाई कैसा है मैंने तेरे को फोटो भेजी है यस कलर ब्लाइंडनेस इज कॉमन इन मेल्स प्लीज रिमेंबर इट इज कॉमन इन मेल्स ओके सो व्हाई आई एम टेकिंग द sex of my patient whether my patient Osama or anyone is a male or a female. If I talk about hemophilia or Duchenne muscular dystrophy, can you please tell me randomly hemophilia and Duchenne muscular dystrophy, they are common in males or females? What do you think, guys? What is the best answer you can think of? Yes, exactly, color blindness is common in males. Some book says hemophilia and DMD also is common in males. What about Hurler and Hunter? I hope you know that we have a lot of mucopolysaccharidosis. Like after we finish this, what we call system of growth and development, we will go to the inborn errors of metabolism, which is the easiest topic on this planet. Okay, yes, beautiful, amazing people. Can you please tell me Hurler and Hunter is common in males or females? I hope you know that it is common in male. It is nothing but inborn errors of metabolism, nothing but mucopolysaccharidosis. And remember, Hunter is a male patient basically who is going to the jungle with a hunter. Just remember, hunter, just random point, remember, in Hunter syndrome, imagine a male patient, a male boy who is going to jungle. So as he is going to jungle means he can see, right? So that's why clouding of cornea. Can you please tell me clouding of cornea is a finding of which mucopolysaccharidosis? It's a neat PG question. Clouding of cornea is seen in MPS 1 or MPS 2. For the newcomers, we have something known as mucopolysaccharidosis, which is of various type, but mucopolysaccharidosis 1 and 2, the Hurler and Hunter, is important. Please remember, as Hunter, a male patient going to jungle means he can see. So clouding of cornea, basically it is not seen in Hunter disease, whereas clouding of cornea, it is seen in Hurler disease. That's important. Okay, yes, Karan Vikram Singh is right, Grace is right. Remember, okay, clouding of cornea, it is seen in Hurler, it is not seen in Hunter. Just imagine that a male boy who is going to the jungle with a hunter, as he is going to the jungle, he can see. So clouding of cornea is not seen in Hunter syndrome. Clouding of cornea, it is seen in Hurler syndrome. Mucopolysaccharidosis part 1. Exactly, perfect. Okay, now this is like back-to-back crazy question. Let's see how if we can answer. In this beautiful case presentation, we understood that the name, age, sex, and now address of my patient. My patient Shubham stays in a hilly area. Beautiful question. Shubham stays in a hilly area. Can you please answer in the comment section if someone is staying in a hilly area, which condition are we talking about? Which condition is common? That's right, Dr. Osama, Shubham. Oh, Shubham or Osama ke comments are back to back. That's good, brother. So there is someone staying in a hilly area. I assume goiter. Yes, very importantly, goiter is common in the hilly area. Remember, naturally because of the iodine deficiency and all that. That's right. So goiter is common in the hilly areas. Next question, please. Any congenital heart disease? Yeah, this is a good question. If I'm staying in a hilly area, can you please tell me, can I have any congenital heart? Can you tell me any one congenital heart which is common in the hilly area? And please remember, today in the end of the class, we're gonna have a small test. I'll give you rupees 200 back-to-back Paytm. I will ask you 5 questions. Just remind me by the end of the class. Let's have a random test, okay? Yes, beautiful. So life is really beautiful. Life is crazy. Recently, we had a nursing exam. I teach to nursing students also. We had a huge success in the nursing group, and like you know, we had this all India rank 1 also from the nursing background, and he was watching my videos of pediatrics by Dr. Anand. So it feels good. It feels nice. Yes, okay. Manish कह रहा है आपने WhatsApp चेक किया? नहीं ब्रो, करता हूँ चेक, करता हूँ गुड्डू, अभी चेक करता हूँ, तू रुक जा एक सेकंड. Yeah, so someone staying in a hilly area, the congenital heart is nothing but PDA. PDA is important. Patent ductus arteriosus is common in people who stay in a hilly area, or who stay in a hilly area. I have only 3 questions to ask you in a patent ductus arteriosis. Question number 1, patent ductus arteriosis is between what and what? Question number 2, what are the clinical features of patent ductus arteriosis? And question number 3, what are the contraindications of giving ibuprofen in a case of patent ductus arteriosis? Can you quickly tell me this crazy 3 super amazing questions? Anyone? Life is really beautiful, guys. No one will respect you if you don't have good knowledge. You must have a beautiful knowledge and a beautiful aura and one second, and beautiful biceps. शुभम, मेरे biceps हो रहे हैं, बढ़ रहे हैं पहले से. मेरे को बड़ी दर्द हो रही है यहाँ पे. शुभम, मेरा WhatsApp पे या Google पे चेक कर यार. I'm having this pain over here, okay? Yeah, over this point. So I don't know what to do. Should I leave gym? I don't know. I'm getting worried. Yes, that's right. ओके कुछ नहीं आता है. क्यों? तू मेरा भाई है, टेंशन ना ले. मैंने 3 क्वेश्चन पूछे, करण कह रहे कुछ नहीं आता इसमें से. तू बाहर मिल मेरे को. Question number 1, what is PDA? As you all know, PDA is nothing but patent ductus arteriosus, number 1. Question number 2, it is between what and what? I hope you know that this cute is my 4-chambered heart, and this one basically, if I tell you this cutie pie, this one and this one, this is the pulmonary artery and this is the descending aorta. And who is this? This part, this is nothing but the patent ductus arteriosus. Number 1, patent ductus arteriosis is between the pulmonary artery and descending aorta, beautifully told by Dr. Alfaz. Clinical features of a case of patent ductus arteriosus: because of the ductal steel phenomenon. Like, I think I'm using hi-fi words. I hope you guys have seen my cardiology classes. I request you to watch my 30 hours of cardiology. It's a PhD level cardiology. It's good for medicine, good for pediatrics. It's really nice. So that's why whatever terms I'm using, no, ductal steel phenomenon and all that, वो दिमाग के ऊपर से नहीं जाएगा, अंदर से जाएगा. You must watch it. Okay. Okay. Let me use some simple 7th class words. PDA is patent ductus arteriosus, which is between the pulmonary artery and descending aorta. As PDA, it is a left to right shunt. Whatever blood is coming from the pulmonary vein to the right, to the left atrium, then to the left ventricle, then to the aorta, from the patent ductus arteriosus, as it is a left to right shunt, all the blood from the left side of the heart, from the left atrium, left ventricle, aorta, it goes to the ductus arteriosus and then go to the pulmonary artery. This beautiful point is known as ductal steel phenomenon. Duct ने चोरी कर लिया. Duct has stolen the blood. Are you understanding? Say yes or yes. Yes, exactly. Yeah, so I'll repeat again. In the case of patent ductus arteriosus, which is a left to right shunt, the blood from the pulmonary veins enter the left atrium, then left ventricle, then aorta, then ductus arteriosus and the pulmonary artery. So the blood, basically the take home message is, in a case of ductus arteriosus, the blood is going from the left side, it is shifting to the right side basically. So what do you call this? This is known as ductal steel phenomenon. The ductus arteriosus have stolen all the blood, As ductus arteriosus have stolen all the blood, compensatory mechanism, you know, because aorta say the whole blood should go to the whole body, right? My whole body is waiting for the blood, right? The aorta, you have thoracic aorta, abdominal aorta, lower limbs, right? If all the blood ductus arteriosus has stolen, which is known as ductal steal phenomenon, compensatory mechanism, the cardiac output and the heart rate basically of the baby will increase. The cardiac output and basically the heart rate of the patient will increase because of the compensatory mechanism. The more and more blood will try to push from the left atrium to left ventricle to the aorta. That is why very, very important, you will see bounding peripheral pulses. Bounding peripheral pulses. Are you understanding? Say yes or yes. Manish Yadav, samajh mein aaya? Yeah. So bounding peripheral pulses, very, very important, and easily palpable dorsalis pedis artery. This is $1 million point, my dear friends. Easily palpable dorsalis pedis artery. I hope you know that, Dr. Shubhangi. Dorsalis pedis artery is a continuation of which artery? Anterior tibial artery continues as dorsalis pedis artery. So the take home message is that in the case of patent ductus arteriosus, if I'm asking you what are the clinical features, you will say because of the ductal steal phenomenon, more and more cardiac output and the heart rate will increase. That will lead to a compensatory, you know, bounding peripheral pulses. Or once I say the peripheral pulses are bounding, peripheral matlab lower limb wala peripheral pulses. That is why the patient will have a easily palpable dorsalis pedis artery. This is the NEET PG question. It will come in exam. Then you can tell me thank you later. That's what. So that's a clinical feature. At least one clinical feature you should know. It's good to ask questions randomly. Okay, this is important. And also, what is the contraindication? I hope you know that. In a case of patent ductus arteriosus, if I want to close my PDA, you will give me ibuprofen. The other options are indomethacin and paracetamol, but ibuprofen is something which is very sexy. So ibuprofen you will give me if you want to close my PDA. But what are the contraindication? Can anyone please tell me? Very, very beautiful point, Dr. Grace. What are the contraindication of the, yes, Orion, a beautiful person by name Orion, he's right. If the patient has thrombocytopenia, if the patient has acute kidney injury, if the patient has necrotizing enterocolitis, or if the patient is bleeding. In these beautiful conditions, you will not give me ibuprofen. I'll repeat again. What drug do you give to close the PDA? The answer is ibuprofen, indomethacin and paracetamol. The best answer will be ibuprofen. And okay, reference is Ames protocol. What are the contraindications of giving ibuprofen? If my patient has thrombocytopenia, you will not give me ibuprofen. If my patient has acute kidney injury, you will not give me ibuprofen. If my patient has necrotizing enterocolitis, you will not give me ibuprofen. And if my patient is bleeding, you will not give me ibuprofen. Has everyone understood this much? Yes or yes. Can I move on to the next slide? Put a thumbs up if you have understood. Tomorrow is the last class for this week. Saturday is my night duty, so I'm not gonna come. Put a thumbs up. You can give a golden heart or a black heart or a blue heart. समझ में आया? करण कहाँ पे है? करण तू पढ़ना शुरू कर दे बेटे. मार खाने से पहले तू पढ़ना शुरू कर दे. करण, you must start studying before I kill you and murder you. Has everyone beautifully understood? Yes or yes? Okay, yes. Let's go to the next slide. Yeah, very, very beautiful. I stay in a hilly area. Any anemias is common? Yes, beautiful point. Can you please answer in the comment section? Grace, Sharma, Neha, Bhavna, Osama. My patient Osama stays in Kashmir. So hilly area, any anemias common in hilly area? I hope you know that. Suraj, thank you for the heart, brother. Yes, exactly. Yes, dear Dr. Shubham, you're right, brother. So sickle cell anemia is very common. Again, an exam question. Examiner will judge you. You must have a bang on knowledge. You should have a like this knowledge. Okay, sir, my patient here Osama, he is from Kashmir. Okay, Kashmir. So which congenital hearts are important? Sir, patent ductus arteriosus is common in patient who stays in hilly area. Goiter is very, very common, and even sickle cell anemias and thalassemias, which are common in Gujaratis, Sindhis and Punjabis, but it is common in the patient having staying in hilly areas also. Yes, exactly. मैं भी नहीं पढ़ता sir. Osama says तू नहीं पढ़ता. इतना प्यारा आंसर दे रहा है. पता है आज क्या हुआ? Today I had I took one interview of a all India rank 1 student today, and this all India rank 1 that person told that sir, I attend your YouTube classes, and one boy name you take a lot, and you said के चप्पल से मारूंगा तेरे को अगर तू पढ़ाई नहीं करेगा, and that person was knowing your name, and he said ये ओसामा एक है बंदा, ओसामा, आप अपनी क्लासेस में ओसामा का नाम बहुत लेते हैं. in your classes you take a person, student's name, his name is Osama, and you tell him I will kill you with a chappal. And I was like, okay, yeah, okay, that's right, okay, that's right. That's right. Yeah. Karan says, sir, mood खराब चल रहा है आजकल, क्यों? तुम्हारी गर्लफ्रेंड छोड़ के चली गई तुमको? क्या हो गया? तुम्हें 100 करोड़ का नुकसान हो गया? तुमने 10 लाख रुपए शेयर मार्केट में उड़ाए? क्या? क्यों? क्यों वो है? Okay, next, in the beautiful case presentation, after the name, age, sex, and address of my baby, informant being the mother. Who is informant? Can you please tell me what is informant? I hope you know that. Informant is the person who presents the history on behalf of the child. Such a beautiful point, because as far as pediatricians are concerned, history taking is really important. Up this 4 days old baby will not tell you I have a pain behind my left ear lobule. He won't tell you that. So informant is the mother, informant is the person who presents the history on behalf of the child. And usually, we always say during the case presentation, informant is the mother and she is reliable. Who is reliable? Number one, yes, Shubham, are you reliable in my life? Yes or no? So reliable is the person who stays with the child 24/7. That you should know. Next point, please. Yes, after this beautiful detailed 3 hours of elaboration of name, age, sex, can you imagine? Name, age, sex, address, and informant. We took 2 classes just to speak about these 4 words. Imagine how many books I might have read to make a 2-hour lecture, 2 hours lecture just on name, age, sex, informant, and address. Can you imagine? So if you are religiously following my lectures, you are on a very beautiful path. Yes, okay, 1 second. Manish says, okay, sir, Karan bhai ki बीवी ने घर आने से मना कर दिया. Oh, that's nice. Karan, you were married. I never knew that. You look like a child. Okay, cute. Grace, mother, as she looks after child more than anyone. Yes, my dear Dr. Grace, beautiful. That's right. Okay. Yes. Suraj says, Osama, Shubhangi, and Shubham are the 3 most taken names by you, sir. That's right, because they deserve it and they are with me from a very long time. But nowadays, in this beautiful journey of my life, we have new people coming. Examples are Karan Vikram Singh. Examples are Amrit. Examples, Manish Yadav was there from a very long time. So, and Grace also has joined, Mansi Panola, Sharma Neha, Moni Mala, and so many other people. And if anyone's name by mistake I have not taken, my apologies, my apologies. Next question, please. Yes, in the present complaints of the patient, I must write, okay. For example, my patient Shubhangi, she has breathing difficulty since 5 days, cough since 7 days, and fever since 10 days. First question I have on this planet, is this the beautiful right order of writing presenting complaints? Yes or yes? What do you think? Hanji, Grace, Sharon, Mansi, Shubham, Karan. Yes. Okay. Yes, that's true. Yeah, Osama. Okay, great. Karan. Okay, that's right. So I hope you know that this is not the beautiful right chronological order. First should be 10 days, then 7 days, and then 5 days. Always remember, that's right. Suraj Kumar Shah is beautifully right, that you must write in a chronological order. That is the beautiful point. मुझे जुकाम हो गया. Yeah, Dr. Suraj Kumar Shah is very right. Fever, so 10 days, 7 days, and 5 days. This is the beautiful chronological order of writing any chief complaint. My patient has a fever since 10 days, cough since 7 days, and breathing difficulty since 5 days. If I have like this question, like this random question, what is the differential diagnosis? I want you guys to be beautifully amazing. Okay, Dr. Grace, can you please tell me, dear, my patient who is a 5-year-old child who has a fever since 10 days, cough since 10 days, and breathing difficulty since 5 days. Like, sounds very, very classy, Someone got a fever, then got a cough, then got a breathing difficulty. Can you please tell me some beautiful differential diagnosis? At least one. Just one differential diagnosis, anyone? Grace, Bhavna, Mankar. Yes, Suraj is right. Suraj is answered right. Can I write pneumonia? Yes or no? Pneumonia. Can I write pneumonia? Second, can I write bronchiolitis? Yes or no? You need to defend, okay? You need to fight, like fight in a happy way, not like a serious fight, but fight in a beautiful way. Okay? What are the points favoring bronchiolitis? What are the points not favoring bronchiolitis? Anyone? Yes, okay. Bronchopneumonias, okay. Pneumonias, yeah. So basically the points negative, which is a negative against bronchiolitis, like 6 months to 5 years. In our OPD and PEDS emergency, the patient which we get of bronchiolitis bronchiolitis are a 6-month-old baby, 1-year-old baby, max to max 2-year-old baby. Usually 6 months to 3 years or 6 months to 2 years the age of bronchiolitis. So first negative point is 5-year-old baby bronchiolitis is less likely. Never say that it is not at all possible, because anything can possible. 0.1% chance is anywhere, in any disease. So say, sir, say in a sexy way, okay, sir, bronchiolitis, I think it's less likely because the age group is not favorable, and bronchiolitis is a happy wheezer or a happy child. Pneumonia is a beautiful point. Yes, beautiful, that's right. Okay, so again I have a beautiful question here. Only let me ask you, because this was the FMG 2022 question. Can you please tell me what is pneumonia and what is a severe pneumonia? Hanji, Osama, शुभांगी, शुभम, आई एम चेकिंग योर आंसर्स, और गलत दे के दिखाओ यहीं पे ब्लॉक करूंगा, यूट्यूब पे ब्लॉक करूंगा. फिर ओसामा का मैसेज आएगा, प्लीज अनब्लॉक मी सर, आई एम रियली सॉरी, अपॉलॉजी सर, प्लीज कैन यू अनब्लॉक मी. हाँ जी, ओके. Yes, my dear Grace Sharon, beautiful Grace Sharon is right. If there was some preceding throat infection or cough and cold, then definitely you can think of a acute rheumatic fever that way. Yes, dear, you can think of actually, but yeah, you can. Pandey says baby looks toxic in a case of bronchiolitis. I apologize, Dr. Pandey. Sorry to cut you, but bronchiolitis patient is usually a happy child, happy wheezer. Okay, he'll be having fever, he'll be having fast breathing. But interfebrile period, the child will be perfectly okay. And most importantly, the child will be playing nicely. He'll be having fast breathing, having creps and all that, and a hyperinflated chest and infiltrates on the X-ray in the case of bronchiolitis. But child will be doing okay. Whereas pneumonia. He'll be jumping here and there. He'll be very sick. मुझे नाक आ रहा है. इस रुमाल किधर है? रुमाल नहीं है मेरे पास. हाँ. I recommend everyone, whenever you have a cold, please blow your nose. Don't sudko it inside. Sudko ki English I don't know much. Okay. Okay. Beautiful answer by Osama Sheikh and Dr. Shubhangi. That's right. Not Shubhangi, Shubham has told the right answer, and Zainab also. Very good. So fast breathing plus minus chest indrawing is pneumonia. Fast breathing plus or minus chest indrawing is nothing but pneumonia. And fast breathing plus minus chest indrawing plus danger signs is severe pneumonia. Are you understanding? Fast breathing plus or minus chest indrawing. Please remember, either the patient can have fast breathing or the RR can be normal. The patient can have chest indrawing. Are you understanding? Plus minus. Fast breathing plus minus chest indrawing is pneumonia. If the patient has a fast breathing plus minus chest indrawing plus danger signs, as in seizures, as in refusal to feed, loss of consciousness, having shock-like features, that is severe pneumonia. And what is the treatment? I hope you know that. Acha, ek aur cheez. And severe pneumonia also you can say stridor in a calm child. I was watching this IMNCI guidelines. IMNCI matlab integrated management of the neonatal and childhood illnesses. In that one they were saying that stridor in a calm child, that also comes as a severe pneumonia. The child is calm, but is having it is a inspiratory low pitch abnormal sound known as stridor, which increases by crying or during feeding. The most commonest cause is laryngomalacia. I hope you know that, where definitely you see a omega shape epiglottis. So that's what. Yeah, that's right. Relax. Okay, yeah, so I'll repeat again. Fast breathing plus minus chest indrawing is pneumonia. Fast breathing plus minus chest indrawing plus danger signs is severe pneumonia. Or a stridor in a calm child also is severe pneumonia. What is the treatment for pneumonia? The treatment for pneumonia is amoxicillin. You give it for 5 days, and if the patient has saturation 90% or less than 90%, then you refer the patient immediately. Whereas in a case of a severe pneumonia, the drug of choice is MP-Genta, ampicillin and gentamicin. Ampicillin for the gram-positive coverage and gentamicin for the gram-negative coverage, and refer the patient immediately if the patient has saturation 90% or less than 90%. That finishes one more part. Has everyone understood this much? Yes or yes? You put a thumbs up, then I'll continue for the next I'll continue further. Hanji, samajh mein aaya? Please give a golden heart or a blue heart, or just say that you understood. Okay. Yes. Okay. Okay. ऐ काश के हम होश में अब आने ना पाए. The dose of amoxicillin, someone is asking, Abhinav Sarva is asking, 50 mg per kg per day. 50 mg per kg per day is the dose of amoxicillin we give in general. MP Genta is not that important, my dear, because it's not a NEET PG question. Just amoxicillin is important. 50 mg per kg per day is the dose that you should know. Next question, please. Presenting clumsy. Yeah, exactly. Oh. बिना सोच चाहिए. एक second. Just 1 second. अपने कान बंद कर लो. I'm gonna blow my nose. Nebulizer. Oh, let's go further. Take a deep breath. Remember that formula, right? 1, 2, 3, 4, and 8 and 9. Remember that, okay? What is 1, 2, 3, 4, 8, 9? Yes. Yeah, okay. So 1, 2, 3, 4, take in breath like. Yeah, okay, let's go further. Okay, गाना सुनाएंगे. गाना एंड में सुनाएंगे. Okay, in the end I'll sing a beautiful song. Yeah, okay. Presenting complaints, as we all know that the presenting complaints, number one is, okay, like, shall we have a recap? Has everyone understood? Can I move further, or you want to have a recap? Tell me quickly, very fast. In this beautiful slide, we understood that in the presenting complaints should be in the form of chronological order. This part which we understood 10, 7, 5 is chronological order. Manish, हाँ जी, सांस लिया मैंने. सांस लिया. सांसों के दरमियान सांस लिया मैंने. ओके. हाँ जी मनीष, सांस ली मैंने. Okay, yeah, and also very important, you take the history in the patient words. In the patient words, you should take the history. Okay, yes. Okay, I have a question. Yeah, Dr. Shubham, perfect. Can I ask leading question? I have a doubt. In the presenting complaints, can I ask leading questions? कब से है खांसी? क्या करेंगे आप? क्या किया आपने? What did you do? What were the aggravating factor, relieving factors? Can I ask, very important, can I beautifully ask the leading questions in a case of presenting complaint? The beautiful answer on this planet is no. You should not ask leading questions, sweetheart. You should just ask, just what are the complaints? Doctor, he's having fever and cough and breathing difficulty, like that only. Okay. Oh, I do acting also. How's my acting? Nice, no? I got this Colgate ad, then I have become a hero only, and I'm asking the Colgate people, do you have more advertisement? Please let me know. I am ready to do it nicely. So please remember, in a case of presenting complaints, what you called chronological order is important, but you don't ask leading questions. Okay, Alfaz, तुम पूछते होगे. अच्छा, शुभम भी कह रहा है पूछेंगे. बेटा तुम मार खा लेगा, लीडिंग क्वेश्चन नहीं पूछते प्रेजेंटिंग कंप्लेंट्स में. whatever the patient is saying, my mother is saying, that only you note in your beautiful noni handwriting, may you write on the case sheet. That's it. Then when do you ask leading question? In a case of history of presenting illness. In a case of history of presenting illness, I hope you know that for any history of presenting illness, what is OPD? OPD is onset, progress, and beautiful duration. You have a beautiful knowledge, guys. I really want you guys to be just amazing. No one will respect you if you don't have a genuinely beautiful knowledge. You must have a beautiful heart, a beautiful knowledge, and a beautiful aura. Always remember the 3 policies of life. You should smell good. So always have a very good perfume. Should I show you my perfume? 1 second. Yeah, I have a very nice perfume. I have this Roberto Cavalli perfume. It is a unisex perfume. It's a very nice perfume. So, or you can have a small perfume also. You should smell good. You should feel good. Should look good. The 3 policies of life. You must know the 3 policies of life. Very important. That you should smell good, you should feel good, and you should look good. You know, there are juniors who message me, sir, when you enter the PEDS emergency, the whole aura becomes like Anand sir has come, like that. So that only you should be. Have a smile, look good, little biceps, 250 grams, looks nice. Yes, so that's beautifully important. Please, Suraj, wild stone. Okay, That's cute. I like good perfume, I must say. Yes, Zara के बहुत अच्छे perfumes आ रहे हैं, बहुत सस्ते भी हैं, 1920 से starting होती है. That's right. Yes, in a case of history of presenting illness, can I ask the leading question? The answer is yes, we can ask. For example, if I say about cough, so for everything, onset, progress, and duration. Okay, the cough was gradual in onset, progressive in nature from last 5 days. Same goes as in the breathing difficulty. The breathing difficulty was sudden in onset, progressive in nature from last 7 days, like that. So in a case of history of presenting illness, number one, I will ask a lot of leading question. I am a crime investigator and you are the chore, and I am chore ki English thief, and I will ask you questions. Okay, onset, progress, duration, very important. After that, aggravating factors, relieving factors, diurnal variations, and postural variation that you should know. Okay, yeah, so I'll repeat again, very important. This is beautiful, guys. For this is like the proper way of writing a case history. Reference 4 books reference I have taken, 5 actually. So yes, very important. So in a case of history of presenting illness, can I ask leading questions? Yes. What kind of leading question should I ask? Your leading question should start as in the onset, progress, duration, aggravating and relieving factors, diurnal variation, then the postural variation. Ma'am, the cough started was the patient's cough was gradual in onset, progressive in nature from last 7 days. The cough was more in the night time when the patient was lying down. The cough relieved on medication. Patient says that, yeah, again diurnal, the cough basically aggravates more in the night, and actually when the patient sleeps on the right side of the patient, the cough increases. So what are we dealing with? Maybe a pneumonia, maybe a consolidation, or maybe a pleural effusion, like that you should think of. Are you understanding? Are you understanding? I hope you're understanding. So the take home message is that in a case of HOPI, that's how beautifully you should ask: onset, progress, duration, and these all are the questions. And can I ask leading questions? Hanji, you can ask the leading questions. So after the name, age, sex, what do you call in address, because occupation we don't take in pediatrics till 18 year, he'll be in school or he'll be kind of at home, and then informant being the mother, chief complaints, history of presenting illness, very important. Yes, Dr. Shubham, that's right. Okay. Yes, okay. And also after that you must write the course during the hospital stay, Now let's move further. Let's dissect every single symptom. Okay, HOPI, I have a question. In that onset, progress, duration. Okay, imagine my patient has cough. Okay, imagine my patient has cough. So onset, in the onset you need to ask, it is sudden in onset or a gradual in onset. So in onset also you ask the time and the mode, basically, as in, like if I say the patient had convulsions which was more in the morning, what is your best differential diagnosis? Are you understanding? Like basically in the onset you can ask like the morning or evening also. In the onset, number one, the convulsions were suddenly in onset, or from last 6 months the patient having convulsions. If I have a question, the patient had convulsions which is more in the morning, can you answer in the comment section? What do you think, guys? If anyone convulsing more in this one? Yes, okay, that's right. Very good. Okay, perfect. Hanji, yes, that's very right. Okay, very good. Yeah, so that's good. Perfect, very good. So please remember, always remember, glycogen storage diseases usually. So glycogen storage diseases are important if you think of what you called, yeah, that's right. Yes, yeah, glycogen storage disease is important. Yes, perfect, very good, that's right. Okay, yeah, 1 second. Yes, okay. Perfect. So yes, so that's right. Karan is right. Manish is right. Perfect. So patient has convulsions more in the morning, you should think of glycogen storage disease. If I have a breathlessness which is more in the night time, like these are the differential diagnosis. I'm giving you scenarios. Okay. Patient had breathlessness which was more in the night time. What do you think? Now someone is beautifully right. Have you heard of PND? Paroxysmal nocturnal dyspnea. These are medicine questions. Someone having breathlessness more in the night time, you should think of paroxysmal nocturnal dyspnea. Someone having convulsion which is more in the morning time, you should think of glycogen storage disease, right? That's true. Now if I say, okay, now mode of onset, I said my patient Karan has cough, which is acute in onset, subacute in onset, insidious in onset, and chronic in onset. Very smart. Can I have 4 amazing differential diagnosis? Can you please tell me any diseases, anything which is acute in onset, subacute, insidious, and chronic? मान जाऊंगा. These are very beautiful questions, bro. Your brain should be like beautiful, like a beautiful flower. Okay, yes, please tell me. Okay, Karan is right, Hannah is right. Okay, tell me 4 differential diagnoses. Any, can you tell me any disease which is acute in onset? Anyone? Okay, yeah, okay, okay. If I say TB, okay, I'll give you one question. You have to fit in the slots. Okay, if I say TB, the patient is a case of TB. What do you think? TB bimari, tuberculosis disease, is it acute in onset, subacute in onset, insidious in onset, or chronic onset? Anyone? Yes, the beautiful answer is TB is a chronic cough for more than 2 to 3 weeks, right? So yeah, that's right. So TB is chronic in onset. If I say foreign body, any idea? Of course, I think you know that foreign body. If I put ABCD, foreign body is acute in onset, subacute in onset, insidious in onset, or chronic in onset. I hope you know that foreign body. So is acute in onset. Doctor, my baby was perfectly fine. He was sleeping in the night. Suddenly, what happened? Midnight, 2 o'clock, and we went to casualty. He was having cough and breathing difficulty. And 3 a.m. in the morning, he went on ventilator. Morning 6 a.m. he expired. Such a short history. The patient भगवान के पास चला जाता है. Such a short history, patient expires. Foreign body or any thrombosis, embolism, very crazy stuff you should remember. Okay, yes, exactly. Yes, Dr. Karan, 3 weeks ki khansi. Bro, you're right, Dr. Karan Vikram Singh. So the beautiful differential diagnoses are even the emboli also. कहते हैं ना कि embolus एकदम दिमाग में, this I hope you know that lot of our family or far relatives, like the uncle, he was perfectly fine. Suddenly he got a heart attack or a stroke midnight. So embolus is something like acutely he'll have a brain damage or even a bleed and all that. So acute episodes, the examples are foreign bodies and embolic episodes. Yeah, even this also. Have you heard of wet berry and dry berry? Can you please tell me what is the meaning of berry? Okay, I have 2 amazing questions. Berry disease is because of deficiency of which vitamin? Number 1. Number 2, what are the clinical features in dry berry? What are the features in wet berry? Any idea? Your time starts now. Yes, okay, you have 10 seconds to answer this question. Berry is a deficiency of which vitamin? And dry and wet berry. Can you tell me one differential diagnosis? Osama, Shubhangi, and Shubham. Yes, that's right. Okay, black Kashi. Okay, Anji, anyone? Yes, that's beautiful. So vitamin B1 is thiamine, vitamin B2 is riboflavin. I hope you know that. Yeah, in a case of that, I hope you know that. So thiamine deficiency causes beriberi. Beriberi is divided into dry beriberi and wet beriberi. That's important. Yes, that's Alfaz is right. Abhinav is a new person to our family. Yes, the patient will have cardiac problem, the patient will have CNS problem. That's very right. Yeah, so as I say wet, it will involve the heart, very important. And I say dry, it can involve the CNS also. Okay, so dry beriberi basically involve the CNS, and as wet beriberi, wet means like a heart, gila, heart. So yes, Dr. Karan Bikram Sim is right that CVS symptoms basically are more common in wet beriberi. Beriberi is because of deficiency of vitamin B1, that is thiamine. Vitamin B2 is riboflavin. This was my final year MBBS question. I remember in my final year MBBS, in my medicine exam, the exam, one ma'am was there, one sir was there from Ambedkar Medical College, Rajiv Gandhi University, Health Sciences, Karnataka, Bangalore. There they had asked me this question, that thiamine deficiency causes what, and wet beriberi involves the CNS more or the heart more. The answer is wet beriberi involves the CVS more. Next question, insidious in onset. That's very beautifully right. That's right. Dr. Prathamesh is beautifully right. Very good. Insidious in onset. Can you tell me one beautiful differential diagnosis which is insidious in onset? Nephrotic syndrome. Yeah, nephrotic syndrome is something which is insidious in onset. Very important. Okay, nephrotic syndrome, I will not ask you what is that. In the renal I will ask you because nephrotic is big. So insidious onset is nephrotic syndrome. Chronic में हम पढ़ चुके हैं. TB is very chronic illness, that you should know. These are the beautiful, amazing points of the mode of insert. They're like crystal points, really very important. Has everyone understood? Yes or yes? Should I continue further or you want to recap or continue? Please let me know. Your time starts now. ऐ काश के हम होश में अब आने ना पाए, बस नगमे यूं ही प्यार के गाते ही जाए, ला 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 ला. Insidious, gradual, like kind of a gradual only. Insidious in onset is like a gradual in onset. Something is known as sudden in onset as an insidious in onset. Sudden is sudden and gradual is like an insidious. Insidious and gradual are same meanings. Continue. Perfect. Continue. अच्छा धीरे धीरे बोल कोई सुनना ले कोई सुनना ले. Yes, in this beautiful class also we understood, see, every single word has to be dissected on the micro level. In the history of presenting illness, what did we learn? Number one, we learned that we should ask the leading questions in HOPI. One beautiful point, we learned that for every symptom, like a cough, cold, breathlessness, whatever it is, it has to be bifurcated in onset, progress, duration, OPD, that's the mnemonic, and then we have aggravating, relieving, diurnal and postural variations. That is important. In the onset is over. In the onset, I ask the time of the onset and mode of the onset. Okay, time and the mode are important on a micro level. I'm telling you, okay, time and the mode. And in the mode, we have beautifully understood these four modes: acute in onset, subacute, insidious, or chronic. This is really beautiful. Next, we have my patient progressive. Doctor, my patient had cough which was progressive in nature, right? Progressive in nature. So I have a beautiful question to ask you. Can you, it's a good question. Yes, exactly. Okay. Okay. Yeah. So, okay. My question is, can you tell me anything in pediatrics where the progression becomes better over the time, worst over the time, and static over the time? This is good one. Okay, anything in pediatrics, कोई बीमारी का नाम बता दो. Tell me any disease in pediatrics, bro, which you can say can become better over time, can become worse over time, and is static. Like, I know the answer, then we have done it. Let's see. Osama. Okay. Okay, Manish Yadav, बड़ा प्यारा है मनीष में. सूरज, yes, okay. Shubham, okay. Yeah, okay, right. Bhavna says nice. Thank you, Bhavna. Okay, anyone? Okay, growth, no. Okay, I'll tell you. If I say cerebral palsy, एक patient आया है, one patient has come, he's a case of CP, cerebral palsy. Can you beautifully tell me in the comment section, cerebral palsy, if I give you an option, where do you want to fit? Cerebral palsy can become better over time, can become worse over time, or is a static problem? Can you please answer in the comment section? Okay, Prathamesh is right. Congenital defects can, worse over time. Okay. Laryngomalacia will be will be better over time. No, cerebral palsy number one is static in nature. So you guys are answering really beautiful. Try to participate. Life is really beautiful. You're answering really amazing. Cerebral palsy disease is a static problem. Someone having mental retardation, which is now known as intellectual disability, is intellectual disability. Someone having intellectual disability is intellectual disability. Like, there is nothing like he went more mentally retarded or less mentally retarded. Mentally retarded is mentally retarded, but now mental retardation is known as intellectual disability. So intellectual disability means intellectual disability. So there is no worsening over time or progression over time. Once the patient has a hypoxic insult, once the baby has not cried immediately after birth, so it's a static problem. आपका बच्चा सारी उम्र के लिए compromise रहेगा. Your child will be compromised forever. He can have a hearing problem, watching vision problem, brain problem, seizure problem. It's a static problem. You can't do anything. Number one. Okay, next question. This class is coming to an end. Life is really beautiful. Can you please tell me laryngomalacia? What do you think? If laryngomalacia is an exam question, what will you choose? Option number A, better over time. Option number B, worse over time. Or option number C, static over time. Any idea? A, B, C? CTV, bro, CTEV also you can say that it's static in nature. Someone having congenital telepathic venous virus is a deformity. Any deformity like a rocker bottom feet Edwards syndrome is a deformity. It will be a static deformity. Deformity if I talk about. Yeah. Yes, yeah, that's right. Laryngomalacia, the omega-shaped epiglottis, as you all know, it'll be better over time. Option number A will be the better answer because laryngomalacia. What is the surgery for laryngomalacia? There is no surgery for laryngomalacia. By 6 months of life, the child, the flaccidity of this omega-shaped epiglottis will be okay over time. So you don't have to do anything. It'll be fine. After 6 months, it'll be fine. Please remember. Okay, beautiful. So one thing which we have understood, even the thromboembolic manifestations also. Someone having a thrombus, definitely as an acute in onset, he will have a major problem. But thrombus can get dislodged and can go somewhere else also. So the patient can become better over time in a case of thromboembolic manifestations. Very, very important degenerative disorder. Can you tell me again, can you tell me any one beautiful condition which can worse over time? One syndrome we have. We have one syndrome. Yes, Dr. Karan Bikram Singh, you're right. Yes, Dr. Karan Bikram Singh, the most commonest cause of stridor in a child is laryngomalacia, brother. You are very, very right. Omega shape epiglottis is right. The patient will have a conservative management is right. Or you do a flexible laryngoscopy to see a omega shape epiglottis and laryngomalacia is right. The patient will have a distress which increases on supine position and decreases on prone position. Laryngomalacia again. You're right. Right. Karan is right. खुश हो गया देखो 5 बार राइट बोला खुश हो जा तो खुश हो जा ठीक है लाइफ होपलेस है गुलियन बारे Okay, I think DMDs sounds a beautiful answer. Duchenne muscular dystrophy. The child will have a developmental regression, kind of the child will have a Gover sign. Slowly he'll be bedridden. I have a lot of friends whose sons and daughters, basically male patients. I have seen more of Duchenne, and yes, they become bedridden over time and they expire very soon also. So Duchenne, you should know. And also one very beautiful. Someone has told that answer. Actually, I was waiting for Suraj. So yes, nowadays Suraj is answering. That's beautiful answer. Suraj जो है सूरज की तरह प्रकाश डाल रहा है. Suraj like a sun who is beautifully answering. Can I say Rett syndrome? 1,000 times we have done this. Only Suraj have answered this beautifully right. So Rett syndrome is the one patient which worsens over time. The PG question was a child who was perfectly normal by birth, normal vaginal delivery, cried immediately after birth, no developmental, like no delayed cry, no NICU stay. Baby was perfectly fine till 6 months of life. Then he got a acquired microcephaly and then he got a developmental regression followed by global developmental delay and an acquired microcephaly and a क्या बोलते हैं इसको? What is this one? Yes, very important. Yes, a hand wringing movement, right? Do you agree with me? Yes or no? Hand wringing movement. That's right. Hand wringing movement. So yes, very very beautifully told by Dr. Suraj. Beautiful. Dr. Suraj says first time मेरा नाम स्क्रीन पे आया है. पता है मुझे किसकी याद आई इसकी? पता है किसने पहले ये ऐसी लाइन बोली थी? इवन अच्छा मैंने वो हार्ट गंदा बनाया. एक सेकंड तो थोड़ा प्यारा सा बनाता हूँ. रुक जा. Yes. So one student I remember, his name is Dr. Shubham. शुभम जब पहली बार शुभम का नाम मैंने बोला था ना, first time I remember a few months back I told Shubham name that Shubham, Dr. Shubham, very good, you're telling very right. And he's like, first time you have told my name, sir, thank you so much. And today Suraj has told that Suraj says कि पहली बार मेरा नाम स्क्रीन पे आया है. आज प्रसाद बांट के आओ, मंदिर जाओ और 11 रुपए का प्रसाद बांटो. हैं खुश हो गया. ओके क्या करण कह रहे क्वेश्चन भी देखा था फिर भूल गया. कोई बात नहीं ब्रो, कोई बात नहीं. सो दैट्स इंपॉर्टेंट. सो प्लीज रिमेंबर इन अ केस ऑफ एक्वायर्ड माइक्रोcephaly or the patient who was perfectly fine and then became a developmental delay, Rett syndrome is beautifully right, and I hope you know that. Osama has told the answer. MECP2 gene mutation is what you see in a case of Rett syndrome. And static disease, bro, it's CP. These are very important points, bro. Please remember, this is like really important. Okay, next question please. I think 55 minutes are over. Can we stop the class over here? I think it's done. Can we have a quick recap discussion? Yes or no? Please let me know. शुभम तेरे को याद है ना? शुभम, डू यू रिमेंबर? तूने भी ऐसे ही बोला था करके कि यू आल्सो टोल्ड वन डे दैट सर यू टोल्ड माय नेम, थैंक यू सर। एंड टुडे शुभम टोल्ड, नहीं शुभम कह रहा हूँ, सूरज कुमार सेज फर्स्ट टाइम मेरा नाम स्क्रीन पर आया। आया, अच्छा आया। ग्रेट। Can we finish this class over here? Yes or no? Perfect. Can we have a quick recap? Please let me know. Okay. Yes, let's have a beautiful recap over here. And we have done some amazing crazy points today also, we understood. Okay, 1 second. Okay. Okay, 1 second. ओसामा सेज मुझे भी बहुत खुशी मिली थी सर, फर्स्ट टाइम मेरा नाम आने पे अलग लेवल का प्राउड होता है खुद पे। यस ब्रदर, दैट्स वेरी राइट डॉक्टर ओसामा। करण सेज सेरेब्रल पैल्सी पे भी क्लास लीजिए सर। हाँ जी सर, लेंगे सर। तुम पहले जुकाम ठीक कर लो अपना, क्लास तुम्हारी भी लेंगे और सीपी पे भी लेंगे क्लास। ओके, शुभम सेज आई रिमेंबर एवरीथिंग सर, यू आर ग्रेट। थैंक यू शुभम, दैट्स वेरी काइंड ऑफ यू। आई एम नथिंग विदाउट योर सपोर्ट। So let's have a quick recap in 30 seconds in this beautiful $1,000,000 positive, amazing, crazy class. What we understood. We beautifully understood number one, that you did not come this far to go this far. You have a long way. Tell yourself you are a beautiful soul. Tell yourself you are an amazing soul. And tell yourself whatever problems comes in life, you will handle it. You are amazing. Take things light. Problem comes, be light. Light, take things very light. In Hindi we say बड़ी बात को छोटा करो, छोटी बात को कॉटन की रुई की तरह बना के फूंक मार के उड़ा दो। Once we enter in a room, we have three people sitting. One people says, oh my god, such a big thing happened. The second person says, it's okay, it's not a big thing, it's not that a big thing. And the third person says, where is the thing? I don't even think it's even a thing to talk. Are you understanding? For one person it was a very big problem, very big thing, this happened. And one person says that it was nothing, it is a small thing, why are you creating a scene out of it? So again, people's perception, बड़ी, कोई कहता है बहुत बड़ी बात हो गई और कोई कहता है बात तो थी ही नहीं. So that's how you take your brains, take things very light. You did not come this far to go only this far. You have a very long way. I'm telling you, you have a very long way. You just have to believe in yourself. That's it. Okay, in this beautiful 30 seconds recap, we understood that the color blindness is common in males. Even hemophilias and DMDs are common in males. And also hurler and hunter. In hunter, you don't see clouding of cornea. In hurler, you see clouding of cornea. These are the types of mucopolysaccharidosis. And we have a lot of other MPS like Tay-Sachs and HERS and Tauries and all that. Once we go to that cell system, remind me, we'll have a very beautiful class, the easiest topic on this planet. Then also, थक गया, सांस चढ़ गई एकदम. Yeah, then also in this beautiful class, we understood that if someone's staying in a hilly area, you can have goiter, you can have patent ductus arteriosis. Then also beautifully, we understood a beautiful point of ductal steel phenomenon. Then also one anemia which is common in hilly area is a sickle cell anemia, or yeah, and you see hair on end appearance or a crew cut appearance on the x-ray. Then also we beautifully understand that informant is someone, who's a person who presents the history on behalf of the child. Usually it's a mother. She is reliable. What is reliable? Someone who stays with a child 24/7. So, examiner will ask you, okay, frankly tell you, like, common things are really common and rare things are rare. Examiner will ask you, you will say, sir, the informant is the mother and she is reliable. What is reliable? What is reliable? Sir, reliable, karte reh jaoge fir he only you will say. So say, sir, reliable is someone who stays with the mother 24/7. And if the examiner asks you, where have you read this? You tell I have read from a standard book, okay, because this is a line from a standard book and examiner wants that, okay. Yeah, that's what. So in this beautiful class, we understood reliable is someone who stays with the mother, with the child not with the mother, someone who stays with the child 24/7. Then also presenting complaints, we understood it should be in a chronological order. Then also we understood pneumonia, severe pneumonia and the treatments. It's a 2022 FMG question. Then also we understood you don't ask leading questions in a case of presenting complaints. Whatever the mother is saying, just write that quietly in your case sheet. But the HOPI has to be in leading question. The beautiful points are OPD, onset, progress, duration. Then also we understood that some diseases like time and mode is important. Someone convulsing in the morning, you should think of inborn errors or glycogen storage. Someone having breathlessness in the night time, you should think of paroxysmal nocturnal dyspnea. Then also the mode of onset is important. We have four types: acute, subacute, insidious and chronic. Acute, we know that embolic episodes or a foreign body are acute problems. Subacute is like dry beriberi. By time the patient will show you CNS symptoms. Insidious is something like nephrotic, is like a slow progression, gradual progression. And chronic, TB is always a chronic problem, tuberculosis. Then also something getting better over time, we understood. Worse over time were the degenerative disorders and Rett syndrome. And static, CP is static, cerebral palsy is static in nature. Then duration, duration to bhi karani humne. Okay, that's right. So that's it. That finishes this class. Thank you so much everyone for this beautiful participation. Has everyone understood this much? Yes or yes? Please let me know. Shubham says, sir, my mother is still reliable as she can easily tell anyone about my activities, what I do every day. Yes, brother, even my mother also is reliable. That's right. So has everyone beautifully understood this beautiful class? Any doubt? Anyone? Oh, yeah. Chalo, अच्छा याद दिला दिया. Okay, 9:33. Okay, good. Okay, अब हो जाएगा दूध का दूध और पानी का पानी. पानी पिया दे. 1 second, let me minimize this beautiful slide. Okay, so I'm going to ask you only one question. So let's see if you can, answer me. Okay, 1 second. What should I ask? I want to ask you something very tough. Okay, as it's already 9:33, my mom is going to call me anytime for for the dinner. So I'll ask you one question, and the prize money is rupees 200. Okay, and yeah, and the thing is, like, I'm going to show you a picture, and you have to just tell me your best diagnosis, and that's it. Okay, let me think. Let me okay, let me ask you a nice question. Can I ask you a nice question? Yes or no? What do you think? Okay, I think I got the question. Okay, so the question, okay, yeah. Karan says, "Mera reliable hai mera room partner." That's sweet. Okay, so I'm gonna ask you one beautiful question. You have to tell me the answer. Your question starts. The question for today is, now listen very carefully. I'll ask you one question. You have to tell me the answer, and I'll take a screenshot. Who will answer first will get rupees 200 Paytm straight away. The question is. Listen very carefully. Yes, the question is, what procedure has been done on this child? This is the question. Your time starts now. What procedure has been done on this child? I'll take a screenshot so that you can, like, we can have a confirmation of the winner. What procedure has been done on this child? Your time starts now. I'm gonna take a screenshot of who says the best answer. This is the picture. There is some procedure has been done on this child. Your time starts now. Anyone? What procedure has been done on this child? Any idea? This child. Okay, lag क्या यहाँ पे नहीं. Palate repair. What do you call it for palate repair? That's not the right word. That's actually right, but there's a word for that. I'm sorry, there's a word for that. Yes, exactly. Okay, आ गया. Okay. VY-plasty. Okay, my question. Palate surgery. Okay. Palate surgery is right, but there's a term for that. Surgery, there's a surgical term for that. What is the name of the surgery for the management of cleft lip and palate? There's a proper palatoplasty. Nahi. Anyone else? Oh, it's a good question then. Hanji, anyone? One word answer. Cleft palate repair is like, it's a layman word, but there's a word for that, my dear. There's a word for that. Palatoplasty, palate surgery, cleft palate repair. No. Anyone? Palatoplasty, Alpha says no, my dear. Any idea? Okay, I think I'll only answer 5 more seconds. Any idea? Rupees 200 Paytm, I'll do it. Yes, Dr. Osama has the right answer. Who says chyloplasty? Yes, beautiful. So that's a beautiful answer by Dr. Osama. So yes, that's beautifully right. So the winner for today's show is nothing but very, very important Dr. Osama, which beautifully says that's right. Chyloplasty. I have taken a screenshot, and Dr. Osama has the right answer. The exact word for this, the cleft palate and the lip repair, basically is known as chyloplasty. It is a surgical management of cleft lip. Dr. Osama is the winner. Can we please congratulate Dr. Osama? He wins. Osama कितना cute सा बनाया मैंने Osama. Yes, he wins rupees 200 Paytm. Dr. Osama, I have your number already, so I will send you the prize money. Tomorrow is the last class. Tomorrow the class again at 8:30 p.m. with a continuation of the case presentation on our Pediatrics by Dr. Anand app. If you don't have the app, the link is there in the description below. Please download and enjoy life. Thank you so much, everyone. Please take care and what? Bye. Bye.